Regarding the manual therapy that you mentioned, do you recommend lymphedema patients to do massage, or is there any other treatments they should look for?
Yeah, so in lay terms, it's often referred to as lymphatic massage. I try not to refer to what we're doing with manual lymph drainage as massage, because as soon as you say massage, people think about this lovely, nice, squeezing, kneading kind of technique that we use, which is addressing the muscles and addressing skeletal muscular pain and tension. But manual lymph drainage is really nothing like that. Manual lymph drainage is working purely with the skin, and it's moving the skin in a very precise manner, which really helps the lymph system to work properly. Imagine that you've got all these tiny little lymph vessels just sitting underneath the skin doing that, protecting us from invasion. And as soon as you put downward pressure on them, we're actually collapsing the vessels. So our manual lymph drainage technique actually has to move the skin without putting any compression forces in it. So we have a technique that really is very light and sits above the vessels, creates movement in the tissue around the vessels, and that really helps the fluid to get into the lymphatic system. And the way that the lymph vessels work, they have little muscles of their own that constrict the vessels and push the fluid along. And when we use our Dr. Vodder technique in particular, we really stimulate that contraction of the lymph system. So we're actually helping the lymph system to work harder to do its job even better. And it's quite a different technique to massage. In fact, massage can be contraindicated in lymphedema because even though it might feel nice to have a nice squeezing kind of pressure massage, it's actually going to turn up the tap. So we can actually make lymphedema worse if we do a normal massage. Now, when we're talking to the patients about doing their own self-treatment, they will often refer to what they're doing as their self-massage. But we are teaching them a specialized form of lymphatic drainage, not quite as specialized as the therapist does, but something that they can easily perform at home to help the lymph flow.
Good. So how can people find a properly trained therapist, like you mentioned?
Okay, so this is sometimes very difficult because in most countries there's no registration or regulation of a lymphedema therapist. So firstly, you want to make sure that they already have some kind of adequate bodywork qualification, because lymphedema management is always a postgraduate training. So they need to be a physiotherapist or an OT or a nurse or a properly qualified massage therapist to start with, and then they should have taken, as well as that, some postgraduate specialised training in lymphedema management. In some countries like Australia, we now have a register of properly trained lymphedema therapists. So you can go to the National Lymphedema Practitioner Register in Australia and you can find people who've taken an appropriate qualification. We also have, in our Dr. Vodder School, we have an international register of all the therapists around the world who have taken our particular training program. So if you go to vodderschool.com and you can search for a therapist, you will find a therapist in your country that has taken the Dr. Vodder training. So you must be careful about who you go to get your treatment for lymphedema, because it's quite a complex condition, and if the therapist doesn't really know what they're doing, sometimes they can make things worse. At the very least, they may not give you the benefit that you require, and it'll be a waste of money. But usually going to a properly qualified lymphedema therapist will give you a good result and teach you how to manage the lymphedema for yourself. Yeah. So if you'd like to find out more, have a look at the Vodder School website. It's www.vodderschool, that's VODDER school, all one word, vodderschool.com. I also have my own website in Australia, www.movinglymph, all one word, movinglymph, movinglymph.com.au, and I also have a blog on that website, so you might find something interesting in my blogs.